Antiseptics and Disinfectants Part 2. Welcome to my presentation. The objectives of this presentation are to classify antiseptics and disinfectants, to outline the mechanism of action of antiseptics and disinfectants, and to look at sample questions. This is the classification of antiseptics and disinfectants. We had already looked at this classification in the previous lecture. So we have the alcohols, examples being ethanol and isopropyl alcohol. We also have biguanides, example chlorhexidine, halogens. Remember, for halogens, we usually look at iodine and related compounds. An example being povidone iodine. Then we have chlorine and related compounds, and the related compound being sodium hypochlorite. We have aldehydes. The one that is commonly used is glutaraldehyde, phenols, for example, chloroxylenol, also known as Dettol, commonly known as Dettol. We have quaternary ammonium compounds, an example being cetrimide. The other example is benzalkonium chloride. Then we have oxidizing agents, examples being hydrogen peroxide and potassium permanganate. Then we have the acids, an example being boric acid. And then we have metallic salts, and these can also be classified as heavy metals, an example being silver nitrate. And then last but not least, we have the dyes, an example being gentian violet or crystal violet. We are going to use the structure of this bacterial cell to explain the mechanism of action of antiseptics and disinfectants. Alcohols cause cell membrane disruption and denaturation of proteins. Quaternary ammonium compounds cause cell membrane disruption and also denaturation of bacterial proteins. Halogens cause DNA and protein oxidation, while phenols cause denaturation of bacterial proteins and cell membrane disruption. They also inhibit the activity of the enzymes. Aldehydes cause denaturation of proteins, and they also modify the nucleic acids through alkylation. Bis biguanides cause cell membrane disruption and also denaturation of proteins. The oxidizing agents cause DNA and RNA damage through reactive oxygen species, while the heavy metals bind to proteins, hence enzyme inactivation leading to microbes' death, while the dyes cause denaturation of proteins and also enzyme inhibition. We look at alcohols. They cause cell membrane disruption and also denaturation of proteins. They are used as antiseptics on the skin and also as surface disinfectants because you normally use them before hypodermic injections. Those are the examples. You have to be careful because they can cause irritation on mucous membranes and even when someone has open wounds. So those are the examples. Then we have the quaternary ammonium compounds. They cause cell membrane disruption and they also denature bacterial proteins. Where are they used? They have good cleansing action. Why? Because of them being cationic detergents. So they are used as surface and surgical instruments disinfectants. Those are the examples. Precaution is that they are able to form a film where bacteria can thrive. So cetrimide is an example. And then Savlon. Savlon is a combination of chlorhexidine and cetrimide. Remember, chlorhexidine is a base biguanide. So the next classification, we have the halogens. They cause DNA and protein oxidation, and they are used as antiseptics on the skin, and they can also be used in water disinfection and surface disinfection. So we have chlorine and its compounds. We know the compounds that you're talking about. Safety measure, you need to protect the mucosa because chlorine can actually cause the irritation. Sodium hypochlorite is an example, and also chlorine tablets. Remember, sodium hypochlorite is commonly used in hospital settings to actually clean surfaces and even floors. We still continue with halogens, and we've already looked at chlorine and its compounds. Here we look at iodine and its compounds. So these ones cause DNA and protein oxidation, and they interfere with DNA synthesis. So these ones are used as antiseptics on the skin, and they can also be used in disinfection of water. So we have iodine itself and povidone iodine, which is also known as polyvinyl pyrrolidone. What is the safety measure? You need to protect the mucosa because iodine can actually cause irritation. So we have betadine solution, which is povidone iodine, iodine tincture, which is potassium iodide, iodine and alcohol, and then Lugos solution, which contains potassium iodide, iodine, and purified water. We have the phenols. We know the examples under this class. We have chloroxylenol, commonly known as Dettol, and we also have phenol, which is the carbolic acid. Phenols cause denaturation of bacterial proteins and cell membrane disruption, and also inhibit the activity of the enzymes. Where is chloroxylenol used? It is a skin antiseptic, and you can also have an antibacterial soap that contains chloroxylenol. Where is phenol used? It is a commercial disinfectant. Remember that chloroxylenol loses activity after dilution when stored for a long time. So the next class, we have the aldehydes, and the examples here we have glutaraldehyde and formaldehyde. So they are protoplasmic poisons. They cause denaturation of proteins, and they modify nucleic acids by alkylation. Glutaraldehyde is the one that is commonly used in sterilization. It is a chemical sterilant. We are mentioning the word sterilization for the first time here. And it is used to disinfect and clean heat-sensitive equipment. For example, surgical instruments, suction bottles, bronchoscopes, and ENT instruments. While formaldehyde mostly is used as a preservative in consumer products, medical laboratories, and also in mortuaries. What is the problem associated with aldehydes? Formaldehyde has a pungent smell, while glutaraldehyde has a short half-life of about 14 days. The next class we have bis biguanide. The example here is chlorhexidine, and this causes cell membrane disruption and denaturation of proteins. So you can have chlorhexidine mouthwash, you can have chlorhexidine skin antiseptic, and you can also have chlorhexidine gel that is used in umbilical cord care. What is the problem there? With chlorhexidine, it can cause temporary discoloration of the tongue and also the upper surface of the teeth. It may also leave an unpleasant taste. So that is chlorhexidine gel and then chlorhexidine mouthwash. Then we have the oxidizing agents. How do they act? They cause DNA and RNA damage through reactive oxygen species. The examples are hydrogen peroxide and potassium permanganate. Potassium permanganate is a mild antiseptic and also has astringent action. Hydrogen peroxide is also a mild antiseptic and therefore can be used as a mouth rinse to help remove mucus or also to relieve minor mouth irritation. Precaution is that hydrogen peroxide loses potency on storage, while potassium permanganate causes burns in high concentration. Those are the examples. Then you have the heavy metals. They bind to the proteins, hence enzyme inactivation leading to microbes' death. An example or examples include silver, copper, and zinc compounds. And we have something like 1% silver nitrate solution that is used in neonatal gonococcal infection. Silver nitrate or silver compounds can cause staining, and that is because of deposition of silver metal. Then we have the dyes. An example is gentian violet. It causes denaturation of proteins and also enzyme inhibition. It is used in bed sores, ulcers, and also to treat some types of fungal infections. The problem is that the GV causes staining. Then we have boric acid, which falls under acids. It is a weak bacteriostatic agent. It is a weak antiseptic and can be used as an eye wash. It is also used in mouth washes. And the safety measure is that you have to remember that it is toxic and therefore it should not be used systemically. Sample questions. Thank you.